300 eye hospitals in the next 2 to 3 years. That is the main thing which I wanted to talk about. So we are now 155 eye hospitals in 10 countries, and we will be touching 300 hospitals in a massive expansion program. Now for this, number kitte fundraise last year, TPG, Texas Pacific Group, which is the top private equity player, and Temasek, which is the sovereign fund of government of Singapore, gave us 1050 crores. 1050 crores kuduthunnu ippoda. Again now they have given us 664 crores. So actually within a span of 1 year, we have got an investment of about more than 1700 crores plus, nearly, from TPG and Temasek, from two people. They are very big private equity investors. Plus we add to this, we have internal accruals. So we will be pumping in more than 1200 crores now to touch 300 hospitals. Nama main enna irukenge, Tamil Nadu இப்போ நம்ம கிட்ட we have about 40 plus centers, 40 hospitals in Tamil Nadu alone. We will be opening 10 more in new locations. Also Maharashtra we have opened a new corporate office. When any of you go to Bombay, please come and visit it in BKC area. புது corporate office இருக்காங்க. இப்போ நம்ம கிட்ட மகாராஷ்டிரால 20 eye hospitals இருக்கு. We have got 20 hospitals. 10 are in Bombay alone. And இப்போ நம்ம growth இப்படி இருக்கு, ரெண்டு methods இருக்கு. One is we can start from fresh greenfield project start ஆகுது. But we are now going ahead with these Bombay, Maharashtra, brownfield. That means we are acquiring hospitals. So in one shot, we are buying out many hospitals. So the growth is much faster. One more thing I want to tell you all is 3 geographical areas, Delhi, NCR and UP, namakita illange, we are opening into these 3 big areas. And you can see UP huge, Delhi is huge, NCR is huge. Africa le namakita eppo irukku 16 hospitals, 16. We are opening in new countries like Nigeria and Democratic Republic of Congo, DRC. We will be opening 30-40 hospitals in the next 2-3 years in Africa also. So, this 300 hospitals, our main aim in 300 hospitals to show an expansion into India and in Africa. Now, we have 10 countries, we will be touching 12 countries because I said we will be adding Nigeria and Democratic Republic of Congo. One more thing which I want to tell you all is, இப்போ நம்ம இங்கே Tamil Nadu we are opening eye clinics, small centers, tier 3 cities, even in small locations like Chengalpet நம்ம open ஆனது. இப்போ நம்ம 12 eye clinics open ஆனது. ஆம்பூர்ல இருக்கு, we are opening in Karur, கௌரிவாக்கம்ல இருக்கு, செங்கல்பேட்ல இருக்கு, எல்லா பிளேசஸ்ல நம்ம eye clinics. இதுல என்ன இருக்கு, we are going to give free examination for anybody. And you can mention this in eye clinics, all things will be totally free. We were allowing people to walk into eye clinics, examination, everything free. If they need surgery, யாருக்கு இந்த surgery வேணும், கிட்ட எங்க hospital இருக்கு Agarwal அங்க போயிட்டு ஆபரேஷன் பண்ணலாம். But all the examination, everything is totally free in the eye clinics. இப்போ நம்ம கிட்ட 12 eye clinic இருக்கு. We are going to open 40-50 eye clinics by this year end. So as in all, நம்ம ஐடியா என்ன இருக்கு, to show இப்போ இந்தியால நீங்க பார்க்கலாம், there is about 1.2 crore blind. இதுல 55% பொறப்பத்தி இருக்கு. இப்போ நம்ம பார்க்கலாம் இதுல இவ்ளோ patients blind இருக்கு. So obviously if you have more centers, the eradication of blindness is always faster. One more thing I say, with all this we are also doing latest treatment. இப்போ நம்ம சொல்றது latest treatment, pinhole surgery. இப்போ யார்கிட்ட front window cornea இருக்கு டேமேஜ் இருக்கு, நம்ம டிரான்ஸ்பிளான்ட் பண்றோம். யார் சத்து போடுற கண் எடுத்துட்டு இங்க போடணும், அது நம்ம சொல்கிறது ஐ டிரான்ஸ்பிளான்டேஷன். இப்போ நம்ம புது ட்ரீட்மெண்ட் இருக்க பின்ஹோல் சர்ஜரி. நம்ம கண்ணு ஒரு பின்ஹோல் மாதிரி ஃபார்ம் ஆகுது, அப்புறம் கண் டிரான்ஸ்பிளான்ட் வானா அதர் கேசஸில். ஸோ இன் மெனி கேசஸ் which may need eye transplantation today because of pinhole surgery will not need eye transplantation. And please understand, this is a big benefit because it's not only in India, even in Africa we are doing pinhole surgery and these patients can benefit from that. So again, to tell you in a summary, basically what I want to tell alla perkitta enna solnom, number 1, Agarwal Kan Hospital is going massive expansion to touch 300 eye hospitals in the next 2 years time. Second thing is, TPG and Temasek gave us 1050 crores just now 1 year back, and again now they are giving us another 664 crores they've already given us. With all this, we are going to invest another 1200 crores to create these 300 hospitals. We are also opening up Agarwal eye clinics. Na solne Amburle, Karurle, in many places நம்ம Agarwal eye clinic open ஆறுது. Africa we are expanding further and opening into new countries like Nigeria and Democratic Republic of Congo. இப்போ நம்ம கிட்ட ஜாம்பியால இருக்கு, நம்ம முன்ன ஒரு ஹாஸ்பிடல் இப்போ 4 இருக்கு, மொரிஷியஸ்ல இப்போ 3 இருக்கு, மொசாம்பிக்ல இப்போ 2 இருக்கு. So we are going to deep dive into these countries so that we can expand further. Okay, I'll ask my CEO Dr. Adil also to say a few words.
Hello everybody, thank you all for being here. Firstly, would like to take a moment to thank all of you for your support and everybody from Chennai, because we have grown from 1 hospital to 150 hospitals and now are the largest player in many of these states. Mumbai we have 10 hospitals, Maharashtra we have 20 hospitals now. So we have a total network presence across the rest of the country except Delhi, NCR and UP. It's a great thing for a Chennai-based firm to get investments of such size from across big investors in USA and from Singapore. Whatever investments will come, we will be using that to expand Agarwal Eye Hospital network across the rest of the country. We're looking at expanding more into Mumbai, into Delhi, into UP, into Punjab, some of these regions. Along with this, we are also looking at setting up 100 clinics like what he was talking about. Look at, right now we have, as an Agarwal Eye Hospital group, we have over 400 to 500 doctors and over 4,000, 5,000 employees. With this expansion, we are looking at, catering to at least 10,000 to 12,000 employees, providing employment opportunities, 10,000 to 12,000 people, and over 1,000 doctors. Along with this, a lot of other opportunities we will be able to provide to a lot of people. We are looking at setting up big hospitals in most of the major cities, along with smaller hospitals in tier 2, tier 3 markets. So it's not like we're only looking at Chennai or Bangalore or Hyderabad. Tamil Nadu Pathina, we have in Tirunelveli, we have in Nagarkoil, we have in Madurai, we have in Trichy, all these kind of places. Similar strategy we are following in other states as well. In Karnataka, it's not just Bangalore. We have in Hubli, in Dharwad, in all these smaller markets. That is the way we are looking at expanding, and hopefully we should get to about 300 hospitals in the next 2 to 3 years. From there, the long-term plan is to get to 500 hospitals across the rest of the country. Not just in India, but we are providing great work because of our team in Africa as well. There also we are treating patients who have no access to healthcare. So I think it is a very, very proud moment for people, from Tamil Nadu. Overall, if you see, the India market is getting a lot of funding from across the world, especially in the healthcare sector. So it is not just Agarwal. If you see our close neighbor, Kaveri Hospital has also recently got a fundraise done. Apollo Hospital is obviously doing very well. Another player from here, Maxivision, also got funding done. So lot of support is coming in terms of healthcare investments into Tamil Nadu-based companies and India per se as a region, which just shows that the story for the next 5 to 10 years lies with India. Indian economy is growing really well. Along with that, a lot of investments are coming in from a lot of global investors who see India to be the next big opportunity. So, once again, want to thank you all for coming here and listening to our expansion plans.
One more thing I want to tell. Today, every day, ஒரு நாள்ல number 10,000 patients in a single day we are seeing, plus across the board. Approximately 10-15,000 patients every single day. நம்ம பார்க்கலாம். That means one patient comes with at least 2 attendants. So every single day, at least 50,000 people are walking into some Agarwal hospital or not. This number will actually double. So effectively, in the next 2 years' time, we will be touching 1 lakh people walking into Agarwal hospital, some center or the other, every single day, which is going to be huge numbers. That is what. So with all this number expansion பண்றது high tech quality care கொடுக்கிறது. So we are trying to make the whole system in eye care into an organized sector. So the advantage when we are buying out hospitals is we are getting ready made, the doctor, the team, the equipment, everything is ready made available there. That is why Bombay le நம்ம open another better to acquire. Punjab le இப்போ நம்ம கிட்ட 7 hospitals இருக்கு, ஜம்முல இருக்கு, and that is the main aim of the group. I want to thank everyone for coming here because we thought this is a very, very big expansion project and we wanted to share with all of you. Thank you so much, everyone.